So first, I'm joined today, obviously, by Dr. Martell. Again, thank you for your leadership that you've shown throughout this entire pandemic and leading our county and all of our citizens through this pandemic and now into the vaccination stages. So here locally, we are encouraged by the continued lowering positivity rates and the fewer new cases that we're seeing. Our hospitals are beginning to see that slight decline in patients that they're treating for COVID-19. Now, more than 10,000 healthcare workers have, some of the hardest working heroes throughout this entire pandemic, have received their first round, and many are already receiving the second round of their vaccine. I want to say a thank you to our healthcare workers for all their brave and tireless work. I want to thank those in the community who continue to take this pandemic seriously and are doing everything that they can to keep themselves and their family safe and healthy. We've been on this road now for just over 10 months, and it's been, I would say, easily to say, difficult for all of us. The small sacrifices and sometimes not so small sacrifices that every citizen and every employee is taking is paying off and is helping our community now in the long run. So as I've mentioned, we've been seeing that progress in Winnebago County and in Region 1, and I want to speak on that briefly. We are anticipating that there could be a move from our current Tier 3 mitigation to Tier 2 as soon as this weekend. And I want to preface this, folks. I don't want anyone at home to think myself or Dr. Martell is being coy. We get information from the state, and once in a while, we may not get that information far in advance of all of you. So we are trying to prep while also understandably maybe not having the full picture ourselves, okay? We are anticipating that there could be that move from Tier 3 mitigation to Tier 2. I want you to know I am advocating for some modifications to Tier 2 limitations with state support also for small businesses. So what would this look like if there are no changes to Tier 2? Tier 2 currently includes ability for limited capacity professional, social, and group meetings indoors. Tier 2 does not include the opening of indoor bars and restaurants for indoor services. While Tier 2 does not include indoor service, consistent with the City of Rockford's past practice, we have, as you all are well documented, limited resources from an enforcement aspect, meaning limited staff to enforce the mitigations that the state has mandated. So we would really prioritize our enforcement on wearing face coverings, practicing social distancing, and contact tracing records. This would include tight requirements on the masking, social distancing, and logging of patrons into facilities. We could also see a limited reopening of organized group recreational activities with attendance limits. This does not prevent our county or state partners from taking any actions to enforce the letter of the Tier 2 standards. This helps keep employees and their customers safe. We're entering into the stage of progress. We know it has been very slow and at times painfully slow, and we also recognize that we have a long way to go. However, I am pleased that we may be taking some small steps towards a broader reopening of our economy that is safe for our employees and customers and citizens. We continue to advocate again at the state level for relief and for support of small businesses and support for our residents, and we will continue to do that. Again, as we say, and I have said at everyone, we really need to continue to be vigilant. We're seeing that positivity rate decrease. I would add, along with that vigilance, we also need to be patient. We're going to hear from Dr. Martell. We need to be patient with the vaccine rollout. as all of our healthcare partners and Winnebago County Health Department are doing a phenomenal job working as fast as possible to make sure that that vaccine gets out to all of our citizens. So with that, I'll turn it over to Dr. Martell.
Thank you, Mayor McNamara, and thank you again for your leadership of our largest municipality in Winnebago County. So throughout this pandemic, we've kind of made a little bit of a mnemonic about the P's, right? We've planned, we pivot, and we're going to talk about patience. So the vaccination plan. Winnebago County continues to work through the vaccination of the expanded Phase 1A. So we've had to constantly pivot and plan as they expand out the capacity. We are working through the second doses of the healthcare workers, and I've tried to really kind of explain this before. So everything we did, let's say week 1, in 3 weeks with Pfizer vaccine, we have to replicate. If it's Moderna, it's 4 weeks. So you kind of have to have that, I'm going to call it in like sporting, a bye week, right? Where we're just catching up on the second doses. Because for this vaccination to be effective, it needs the 2 doses to get the 95%. So we're working to vaccinate residents of the community integrated living arrangements. Today we are out at Milestone vaccinating. And between all systems, and the mayor referenced it, over 10,000 doses have been administered. And over 3,000 healthcare workers in Phase 1A have completed their initial series, meaning that they've received their 2 doses. The Illinois Department of Public Health has put up a dashboard that reflects vaccination by residency. And so I always say we're challenged in Winnebago County because we're a large employer. So many individuals come into our county and they are being vaccinated as part of that healthcare workforce because they care for patients or have an office here, but their residency is outside of the county. So I don't want people to say it's a 1-for-1. We are here to vaccinate those healthcare workers right now in Phase 1A that are in Winnebago County. Working with healthcare system partners, we've kind of put out a challenge to all of us. We would like to minimally, collectively vaccinate 5,000 per week. And people, different organizations have stepped up to the plate. We talked a little bit about this during the hospital phase. It's not about the beds, it's about the staffing. So it's not always about the vaccine, it's going to be about the staffing. Because we're continuing to provide healthcare services. Crusader Community Health has stepped up. Marathon Health, which is the provider of Rockford for their occupational medicine, is going to be stepping up to help us. Mercy Health System, Oak Street Health System, OSF St. Anthony, UI Health Miles Square, Swedish American, and of course the Health Department. We have put out a collective challenge. And we understand this is going to be difficult because most of the time we're taking care of patients that present to our systems that are our patients, but we have a community to vaccinate. And so we're having to kind of work through some of those. If you're a healthcare provider who's willing to vaccinate community members, please reach out to the planning team by calling the hotline, 815-319-6705. 815-319-6705. All hands are needed, all hands on deck, as we say. So as we pivot, we expanded the healthcare group to Phase 1A, and we've been working through that group, which is very diverse and very large. These are providers not affiliated with hospitals. Things like dentists, mortuary care, blood bank, physical, occupational speech therapists, home health agencies, optometrists, and the school nurses have been coming through. So we've been trying to vaccinate this very large expanded group. We've talked about the congregate facilities that are outside of corrections that were not eligible to be matched with Walgreens or CVS. So when they could not be matched, it was up to the health department and its partners to vaccinate those individuals. So we've been looking at the Milestones, the Stepping Stones, Mosaic, and other entities like that that could not be matched. Simultaneously, I know we're all excited about the transition to Phase 1B. So we're going to be doing Phase 1A and Phase 1B together. And I know we know Phase 1B represents almost over 2/3 the population of our county. It includes those aged 65 and over. Fire responders, first responders include fire, law enforcement, 911 dispatch, security personnel, school officers. It includes our educational system, the teachers, the staff, the support individuals in pre-K through 12. Those who work in food and agriculture for our food processing plants in Winnebago County. And agriculture, our veterinary medicine. Selected manufacturing, not all manufacturing, selected manufacturing. Corrections, including workers and detainees and inmates. The Postal Service, public transit workers, including our Rockford Mass Transit and our ride-sharing companies like Uber and Lyft drivers. Our grocery store workers, think about how essential we know they were. They're going to be part of this, and shelters and adult daycare. So when you think about trying to vaccinate that population, I want people to understand, I'm going to say it multiple times over, we are in a marathon, but we are gearing up, we pair up, we are doing it every day, and we need your patience. The good news is that over 32,000 of our community residents have registered online. That's a tremendous lift in support for us because that's one less staff person we have to put toward that. We can instead make sure that all our staff are out vaccinating. I reiterate that Phase 1B includes almost 2/3 of the population of Winnebago County. And once you've registered, I've heard, well, when do I get my appointment? Is that going to be tomorrow? When's that happening? It will be prioritized. So I've got those occupations, right? Age, risk factors, and zip codes with our highest disease burden. From the start of this, we said that we had community zip codes that had suffered the highest degree, and we will be bringing those through first so that we can make sure that we are getting the most vulnerable. And I want to remind everyone, you may be vaccinated outside of your usual healthcare provider. Because similar to what we said about treating and administering COVID patients, is that we're going to function as one system. And that's a hard concept. It's a hard concept for the healthcare providers. They're used to being good primary care providers to patients enrolled with them. But we have to function as one system if we're going to vaccinate as one system and vaccinate our population. Because the same healthcare workforce that has cared for you throughout the pandemic has shifted to provide you with vaccination. And as I explained before, operations have to be replicated at 3 and 4 weeks, depending on the vaccine, to ensure receipt of that second dose. Just receiving one dose, at this time, the FDA is not saying that it will provide the level of protection we need. And vaccines each have their own logistical challenges. Shelf life, you're hearing about this freezer, we have to put them out the night before, we have to kind of know who's going to come to the clinic so we can defrost the right amount because they have a shelf life once we start defrosting. They have different storage requirements. We talked about the Pfizer and the ultra cold, and if I could show you the big box of dry ice they ship me to kind of re-scoop it on every night, you realize this is not like we normally get for vaccine. But good news is both Moderna and Pfizer have produced bonus doses. Typically, Moderna was supposed to get 10 doses out of vial. We were able to get 11. And out of the Pfizer, we've been able to get 6 to 7. And all of the clinics that are working to vaccinate are working not to waste a single dose. So sometimes I hear, well, I heard so-and-so got a vaccination. Well, if we're at a place and we've got 1 dose left to go, we'll say, does anyone need to be vaccinated? And typically we get 1 person. But we might say it might be the volunteers at the hospital. We pull them through and we vaccinate. The idea being that we're not letting anything go to waste. But that does not mean we are phase jumping. And I think it's important for people to understand that counties are at different phases based on their populations. If you have a chance, you can look at that map. And you think, wow, we're a very large state, very diverse in population. We know that the northern part of the state has more population. We tend to be employment centers. Rural have less, but they still need to be vaccinated, and we still need to make sure we have plans for them. But a couple of things we have to talk to everyone. You should not be charged for registering or making an appointment. If you get a call and they want to charge you money for registering or making an appointment, stop. Don't give any information. Do not provide your Social Security number. And do not provide anything about your immigration status. We know already that there are attempts to either fraudulently claim money out of this vaccination effort, send people solicitation that I can get you a vaccine sooner or later. I want to caution the public. Go to our website. We know that there's some that cannot do that. Try and work with a family member to register you. For some of our citizens, we're calling them that need help going through it. We will work that through. Because we want to make sure we're using a trusted system, and we don't want you providing personal information to a system that cannot be trusted and is not going to provide you the vaccine. Coming back to this, it's a marathon, not a sprint. I'm with you. I wish it was a sprint and we could say, in a month from now, we'll be done and we can return to life as normal. But we're not there yet. And if we want to continue to be able to open our businesses safely, our schools have returned to in-person. We understand from all of the schools reporting that they have more children returning as part of the in-person learning environment. We're going to have to continue to wear our face coverings when outside of the house, regardless of vaccination status, practice social distancing, wash hands frequently, stay home when you're sick. I'm still amazed. We still have not lifted that. There's no new rule that says, please power through this. We want you to stay home. Our employers are continued to encourage to have people work remotely as much as possible. Limit your contacts. And with that, today's the numbers we'll be reporting. We have new cases for today is 104, which brings our total case count to 24,505. The ages in the cases were 10 months to 94 years. And unfortunately, we have lost 2 additional of our community residents, which brings our total death count to 380. Our heartfelt sympathies again are with the families during this time frame. It is very difficult to lose a person to COVID and not be able to be there with them. Our test positivity rate is 10%. The regional is 8.9. So we got a little work to do here, folks. Even though we're looks optimistic that we're going to be coming into Tier 2, we have to work hard to hold that line. And we've been in mitigations since October. We've worked hard to get these numbers down, and we are going to continue to have to work hard. We're reporting our recovery rate at 98%, and we have one location of concern, which is a home for the developmentally disabled, Glenwood Terrace. And as of yesterday, Rockford hospitals were providing inpatient care for 101 patients who have tested positive for COVID-19. And this is a decrease from Thursday's report of 102. And while that's one, we're going to have to continue to hold the line. So again, reminding the population, now our third word is patience. So we're planning, we're pivoting, and we're trying to encourage each other to be patient. We will vaccinate everyone who wants to be vaccinated, but it will not be tomorrow. It will not be overnight. We do not want people lined up in cars where they are stuck in lines that they can't. We know that different members of a household might be in different phases, in different priorities, but our goal and intent is to vaccinate everyone safely and effectively. So with that, I'm happy to take any questions.
Second.